Myself, Dr. Sourabhi Protocol, Faculty of Biology. Today our topic of discussion is locomotion and movement. First of all, we discuss about the skeletal system, that means the bone. This is the half of the skeletal system. First of all, we discuss about the skull. What is skull? Skull is consist of cranium bone and facial bone. This is the facial bone, this is the cranium. Togetherly, the total bones is known as skull. First of all, we discuss about the cranium bones, that means hair. That is hair. In cranium bones, we see that the forehead part, that means hair. This part only known as frontal bone, that faces the front. This is the midline. The two part is known as parietal bone. Here the ear is present, that is known as temporal bone. Both sides temporal bones are present. And the back side where the parietal and this bone is attached, and this surface is called occipital bone. So the bones are frontal, two parietal, two temporal, and one occipital bone. Now come to the suture. Suture means joining of skull bone. It is called suture. The first suture is about the frontal and parietal bone. Here the dotted line are the sutures. That means joining of skull bone. They are the immovable joints. Remember, they are the immovable joints. The first suture is coronal suture. Remember, frontal and parietal are joined together by coronal suture. Second one is two parietal bone, left and right parietal. They are joined by sagittal suture. Joined by sagittal suture. Parietal and temporal bone are joined here by lateral suture. Lateral suture should be two types, right lateral, left lateral suture. Now coming to the back side where occipital bone and parietal bone joined together, here another suture is present which is known as rhomboid suture. Students, rhomboid suture. So coronal, sagittal, lateral and rhomboid suture is present. That's all from the cranium bone. Now come to the facial bone. Here nasal bone is present, nasal cartilage is present. That is called zygomatic arch. Both sides. Zygomatic arch. Here is called maxilla. That is called mandible. Mandible is the strongest bone inside the skull. Strongest bone because due to presence of masseter muscle. That means masseter muscle. That's all from the cranium bone. Now come to the vertebral column. That means from where the spinal cord passes. From the neck region, there is a hole is present. You see that there is a hole. This hole is called foramen magnum. Called foramen magnum. This hole. From the base of the skull, this hole is present. From here, the spinal cord originates, or the vertebral column originates up to this side. On the neck region, the vertebra is cervical vertebra. Chest region, it is thoracic. Back region, it is lumbar. That is sacrum region, that is sacral. And the small bone is coccygeal or coccyx. That is the vertebral column bone. Students, that is the vertebral column. There should be 33 bones are present in vertebral column. Now, that's all from the axial skeleton. There is another part of axial skeleton, that is rib cage. This is the rib cage. Ribs are joined together by this central bone. It is called sternum. This is called sternum bone. The sternum's upper portion is, this portion is sternum, is called manubrium. This is called body. And the lowermost portion, the red portion is called xiphoid process. This is called xiphoid process. Now, from the sternum region, the ribs are originate. There will be total 12 pair of ribs are present. 12 pair ribs are present. Among these, the ribs that originate from the sternum and attach to the back side to the spinal cord or vertebral column are called true ribs. Origin from sternum, join on the vertebral column are called true ribs. 1 to 7 should be true rib. 1, 2, 3, 4, 5, 6, 7. 1 to 7 should be true rib. The vertebra or the ribs originate from sternum, but before joining with the vertebral column, they join with the true rib are called false rib. 8, 9, 10 are called false rib. 8, 9, 10, these three are called the false rib in the both sides. And two types of bones are present. They are called floating ribs. They originate from the vertebral column, and there will be no joining of these two bones, 11 and 12. These two bones, 11, 12, 11, 12, these two are the floating ribs. So ribs should be true rib, 1 to 7, 8, 9, 10 are false rib, and 11, 12 are the floating rib. So that's all from the axial skeleton. Now we discuss it in